In my last video, I have discussed about the Canadian education system. In this video, I'm going to talk about the Canadian healthcare system. Before that, let's see the current immigration updates in Canada. The Indian government has claimed that international students are being trafficked into the US through Canada using colleges and universities as a front. Kelly Sundberg, a professor at Mount Royal University, says Canada's honor-based immigration system is being exploited by transnational criminals, yet it has virtually no oversight or enforcement. Starting from spring of 2025, Canada will implement following 4 decisions. Number 1, removal of LMIA, local market impact assessment, supported job offers to prevent purchasing fake LMIA job offers for large sums of money. Currently, candidates can earn extra 50 to 200 points for job offers in Express Entry program, but it will not be continued. Number 2, eliminating flag polling. Flag polling is a process a foreign national who holds a temporary Canadian resident leave Canada and after a visit to another country re-enter. Number 3, to have a strict border control measures to tackle the fraud, especially Indians attempting to enter Canada or US illegally. Number 4, Canada introduces a new permanent residency program for foreign workers for the Francophone community. Now, let's jump into the Canadian healthcare system. Canada's healthcare system is a universal, public-funded system that provides necessary hospital and medical care to all its residents without any cost to its residents. This valuable service is not designed to make profit, but to improve Canadians' health. In Canada, all residents can access the healthcare system regardless of their income and no rank for that service. The same qualitative service is provided to both the rich and the poor. The system is funded through the federal, provincial, and territorial taxes such as personal and corporate taxes, sales taxes, and payroll levies. Some provinces may also have a health premium on their residents. While the federal government sets national standards and provides funding support, the provinces and territories are responsible for delivering healthcare services. There is no cost sharing for public insured physicians, diagnostic, and hospital services. Even though Canada spends more than 10% of its GDP on healthcare, the health conditions of its citizens during the COVID period put a considerable burden on the healthcare system. No one can say the Canadian healthcare system is perfect, but recently several international analyses comparing 195 countries showed that Canada's care ranks in the top 10% of countries and it is one of the highest quality medical services in the world. Compared to the international community, Canada's healthcare spending per person is very high. Canadians are privileged to have fair laws and regulations on patients' rights as well. People in Canada only go to hospitals for emergencies. For a general illness, one should consult one's personal physician and seek treatment. The government pays the doctor's fee, but the medication is not free. So patients should buy medicine from the pharmacy. Many people have insurance for that, and elderly people and people with low incomes can get medicine for very little money or free of charge. Canada is a country that hosts a lot of refugees. As a country that protects human rights, even if it is a big burden for the government to provide free health facilities to every refugee, the Canadian government is happy to fulfill it. As a country of large number of immigrants, Canada's healthcare is under a heavy burden. Canada has to bear the health needs of immigrants, but also the government to provide needs of not just immigrants, but also their elderly parents and families. For this reason, hospital emergency departments are currently somewhat overcrowded. One thing that needs to be emphasized is the humility, kindness, and attention of the doctors and other staff in the Canadian hospitals. There's no group called attendants like in many other countries. Nurses are the ones who wash the patients, feed and clean the weak and elderly people. Doctors and nurses can be identified only by the name badge that they wear. Almost all the staff have the same uniform. Everyone provides services to the sick regardless of their rank. Unlike in many countries, there's no difference in the situation between doctors and other minor workers. People in Canada have the right to receive high quality patient care with compassion and dignity. At the same time, in planning the patient's recovery, the doctor and the healthcare team treat the patient, discuss with each other and choose the best method for the patient and the family. The patient always knows what treatment, surgery and medicine will be given to him, but always they are bound to respect people's privacy. Not only in the case of illness, before going home after recovery, the hospital teaches things like physiotherapy, necessary exercises to live independently. And in case case of an accident or critical situation, the response system is very fast. An ambulance will reach the patient within minutes. If the road is difficult, a helicopter takes the patient to the hospital. In addition to the direct care provided by hospitals and doctors, the Canadian government provides many services for the sick and elderly. There's a sick or older person at home who cannot be taken care of by the family. Someone will be sent to help them free of charge. Depending on the patient's need, they come home 2 or 3 times a week, or daily, or twice a day. They give a bath, prepare meals, wash clothes, and so on. Every normal person gets a full checkup at least once a year. Based on the results, the doctor advises the patient on what to do to stay healthy, such as eating healthy and exercising. And Canadian doctors use the least amount of medicine, as they are reluctant to give medicine for minor illnesses like colds, and recommend home care or minor medicine without any side effects. A valuable service is taken up by the government recently to provide dental care to children for low-income families and seniors, which had been lacking in Canada. Because of many reasons, Canadian healthcare system faces many challenges today, like overwhelmed emergency rooms, lack of access to family doctor in some rural areas, wait times for selective or non-life-threatening specialist care. Still, Canada has one of the best healthcare systems in the world. In my next video, I'm going to talk about the Canadian human rights protection.
Oh, yeah.